Hi, I'm Bill Coase. I've been a physician here in the Findlay area for the past 40 years or so. One of the things all doctors are concerned about are side effects of medications, the problems that can occur when you take any kind of a medication. There's no free lunch. One of the specific things that we've seen more of concern are related to pain medications, specifically the opiates. We've prepared this video so we can talk to you and your family about potential side effects so that you become educated as to problems and you can help make your own decisions using medications.
You know, opium has been around. It's one of the oldest drugs that's known to man. And we think about the opium poppy seeds, and you know, those have been cultivated for quite some time for the use for medicinal purposes. But most of what we see now are synthetic derivatives, and we refer to them as opioids. Those that are like hydrocodone, Vicodin, for example, is a brand name of hydrocodone. We also see oxycodone. OxyContin is a brand name that's widely used today for chronic pain. We also see just codeine, and we also have some derivatives that are opioid-like, like tramadol or Ultram.
The FDA only approves drugs that are shown to do what they're intended to do, and that their side effects are not so severe that when they're used as prescribed and monitored, that they are very unlikely to cause someone problems. Every drug has side effects. Every drug, whether it's a blood pressure medication, a cough and cold medication, any drug you take, prescription or non-prescription, has the potential to cause side effects.
All drugs that we utilize in pharmacy and in medicine are safe and effective if used appropriately and monitored appropriately, but they all have risks. And that's why we see the importance of a physician and a pharmacist that manages the care with all drugs.
So after a person takes a pill, an opiate or an opioid as described, some of the effects that patients could experience after taking the pill are senses of, first and foremost, pain relief. Some of the common side effects that patients experience after they ingest an opiate or opioid, it'll make them drowsy, okay, especially initially. Sometimes opioids make people feel good. Right? There's a sense of euphoria or a subtle high, if you will, that patients can experience from taking an opiate or an opioid. But again, too, those are some pleasant side effects, perhaps, save for the sedation. You can also have some not pleasant side effects.
My name's Brad. I see myself as someone who grew up in a small town in Ohio that never smoked or chewed or drank or did any of that. Pretty much never saw myself being an addict or someone that was on that path at all. I saw myself on the straight and narrow. Everything was kind of all aligned in my mind of what was going to happen in my life. You know, I'd be prescribed Percocet or something like that. And I mean, you know, you take one of those and the purpose is not to get, for me at least, wasn't to get high or anything. It was literally because I just had surgery and stuff. But I guess that's just an effect that you have along with it. I mean, you feel kind of good.
My addiction process started when I was really young because sports was always a very big thing in my family. I was a very good wrestler in middle school, and I was a very good wrestler in high school. I had my arm twisted around my back in wrestling, and I had a lot of torn and pulled muscles, and I was prescribed Vicodin.
You know, you start taking one, doesn't do it, you know, after a week, and you start taking two, and then doesn't last, and then you start taking three, and it just kind of spirals out of control because of your physical response to the medication. Your body builds up a tolerance. It's just, you know, a physical fact.
The addiction spiral is typically a behavior or an incident that causes distress. The patient feels the need to lessen that feeling, numbing the situation, numbing the feeling, if you will.
So eventually I would keep taking more of the pills and more of the pills, and then I would have to keep taking even more of them just to feel the same effect. And after too long, it was more about me just taking pills to feel normal instead of the sports anymore. So eventually it was the pills that started taking over my life, and then the sports faded out of my life, and that became my addiction.
I've even heard of stories where school-age athletes have come home with an injury, been given a prescription by mom or dad saying, here, this will help you feel better, help you perform better as an athlete. That student goes out, feels much better, performs better in the competitions, and then decides that, hey, that worked once, I'm going to take another pill. And from there, it may be something where they're not being provided the medication by a family member, but they start stealing from that family member, which then becomes an addiction and leads to other drugs, street drugs. It can lead to criminal behavior, court action, where that individual's in the courtroom with me on the other side.
The patient needs to make sure that they're taking that medication as directly prescribed by the physician. Okay? So if that label on that prescription bottle says take 1 tablet once a day means once a day.
The change occurs like when you start with the need for it for your pain and you begin to want it for other things. If you have concerns that you feel like the medication is more in control than you are and you're struggling with that idea or the possibility, think about how many times a day you feel like you should cut down, or I'm going to try not to take it. Do you feel like you've possibly built up a tolerance to the drug? Do you take the drugs to avoid or relieve withdrawal or being sick? Do you feel like you're out of control with the drug use? Does your life revolve around your pills and the next pill, or where I'm going to get my pills, or how I'm going to get my pills? Do you continue to use it knowing that it's not really helping the pain and other things in your life are getting worse? Do you have a tendency to want to lie or omit when you're talking to the doctor or talking to others who are questioning you about your behavior and about your drug use? The physical symptoms we reviewed, but there's also more behavioral things that you're going to notice. Their attitude's going to be different. So there's going to be more anger and irritability issues. There's going to be more anxiety and paranoia. They may start to miss work or miss school. They may want to isolate from activities or from people that they normally would hang around with. Their friends would change. The people that they would normally do things with, they stop doing, and those people change. They're doing different activities. Some people can be on an opiate for years and never become addicted, even though they're dependent. Other people have that addictive brain, in a sense, that switches, and it goes very quickly from based on what needs are to more of wanting it.
Medical history is important, particularly with respect to prescribing opioid painkillers, in that a history of addiction, whether it be to physical or chemical means, a history that may or may not include abuse, depression, or other potent psychological or physical stimuli, are things that can be important and affect the way a patient or someone would respond to the use of opioid painkillers.
My dad just passed away from alcoholism, pretty much. I mean, he had some other things, but he had some organ failure. But I was the person in my family, I saw my family being abused. I saw my dad abusing himself, and just in a way, I love the way I was raised, and I'll tell you what, I was kind of showed what not to do.
Regardless of your background or regardless of your history, I think it's critical for an individual who is engaging in opioid painkiller therapy with their physician to be open and honest with respect to their past, their feelings, and how they think their treatment is proceeding, such that the two together can make a decision that's appropriate with respect to future therapy.
There are steps that someone who's been prescribed an opiate should take to make sure that the drug doesn't get misused by someone else besides themselves. One of those things is keeping all of their medication in a secure place, keeping track of how much of a particular medication a person has so they would notice if there was less than they should have at any given point.
When being prescribed opiates, I think it's very important that you keep them somewhere safe, out of reach of other people. It is your medication, it's your responsibility, so you have to take responsibility for yourself. If you have a family member or other family members that live in the house, let them know that you're putting your medication there to help keep an eye on it, to make sure that it stays there. And maybe do a constant pill count to make sure that there aren't any missing. You just have to stay on top of it at all times. It's a very, very serious situation.
The other thing that is an important thing to keep in mind is you may be prescribed one pain medication initially, still have some of it left, and then get prescribed a different pain medication. And sometimes people will have the tendency to keep that initial medication just in case or as a backup, and it's that type of situation where those medications will become misplaced or come up missing or maybe be used for the wrong thing.
Many individuals think that it's safe to get rid of extra medication simply by flushing it down the toilet. However, what we are learning now is that medications flushed down the toilet simply become one more contaminant in the water supply. So the safest and the most preferred method of getting rid of your excess medication is to turn it into the sheriff's office in their collection box, or the collection box located with the Findlay Police Department in the lobby of the municipal building. The drop boxes are intended for prescription medication, preferably tablets of any type. Other medications that you may have in your home, whether they're over the counter, we will also take. The only thing we ask that you don't provide are things with needles, liquids, or aerosol containers that might be common with an individual who has asthma.
The questions that we have talked about or we just alluded to are things that we routinely talk about, and I think it's imperative that someone who is going to engage in opioid therapy with their doctor would bring these issues to light, and certainly when asked, answer with truthfulness and appropriateness. In turn, me as the doctor, I would expect me to talk to you with respect to openness, and that would include risks as well as potential pitfalls when prescribing opioid painkillers for a painful condition.
So let's summarize what you've heard today. This is about your quality of life. It's important that you don't have pain. Your doctor has prescribed the medication and intends that you use it. There are side effects. We want to make sure that you've been educated so that you understand those, and if there's problems that you would call and talk to your physician. We really thank you for listening to this video and hope that it will help improve your quality of life.